Hello everybody, let's talk about those sinuses. You know, those air-filled cavities in your skull that often act up during a cold? They're part of your respiratory system, lined with a mucous membrane that filters and humidifies the air you breathe. When you're fighting a cold, your immune system works overtime. Inflammation from a cold or allergies can block your sinus openings. Trapped mucus can become a breeding ground for bacteria and viruses, leading to sinusitis. Symptoms include facial pain, pressure, headaches, congestion, and reduced sense of smell. If you suspect sinusitis, see a doctor for proper diagnosis and treatment. Let's talk about rhinitis, which is essentially inflammation of the nasal lining. The most common culprit? Allergies. You see, when you have allergies, your immune system overreacts to harmless substances like pollen, dust mites, or pet dander. This triggers a chain reaction, releasing histamine and other chemicals that cause your nasal passages to swell and produce excess mucus. But here's the thing, not all rhinitis is created equal. Non-allergic rhinitis, on the other hand, isn't triggered by allergies. It can be caused by things like irritants in the air, changes in weather, certain medications, or even spicy foods. So, how can you tell the difference? Well, allergic rhinitis often comes with itchy eyes, sneezing, and a runny nose, while non-allergic rhinitis might just involve congestion. Now, let's move down to the pharynx, which sits at the back of your throat. It's a vital part of both your respiratory and digestive systems, responsible for the passage of air and food. Pharyngitis, or inflammation of the pharynx, is what we commonly know as a sore throat. Most of the time, it's caused by viruses like the common cold or the flu. However, bacteria, like Streptococcus pyogenes, the culprit behind strep throat, can also be the offender. Symptoms of pharyngitis can vary depending on the cause, but often include a scratchy throat, pain when swallowing, and swollen tonsils. While most sore throats resolve on their own with rest and fluids, it's important to see a doctor if you have a severe sore throat, difficulty swallowing, or a fever. Ever lost your voice and felt like you were just whispering into the void? That's your larynx or voice box taking a break. The larynx is crucial for speech, housing those amazing vocal cords that vibrate to produce sound. Laryngitis is the inflammation of the larynx, most commonly caused by a viral infection like a cold. Overuse or misuse of your voice, like yelling at a concert or talking for extended periods, can also lead to laryngitis. In some cases, bacterial or fungal infections can also be the root cause. The hallmark symptom? Hoarseness or complete loss of voice. Resting your voice, staying hydrated, and avoiding irritants like smoke can help soothe your larynx and speed up recovery. Let's clear the air about rhinorrhea, which is just a fancy medical term for a runny nose. It's essentially an increase in mucus production in the nasal passages, and it can be a symptom of various conditions. We've already talked about allergies and the common cold, both of which can cause a runny nose. But other things like irritants in the air, changes in temperature, and even certain medications can trigger rhinorrhea. In some cases, a runny nose can also be a sign of a more serious condition, like a sinus infection, or even a cerebrospinal fluid leak. So, if you have a persistent runny nose that doesn't seem to go away, it's always best to get it checked out by a healthcare professional. So there you have it, a breakdown of some of the most common respiratory conditions that plague us. Remember, knowledge is power. Understanding what's going on inside your body can help you make informed decisions about your health. If you're experiencing any of the symptoms we've discussed, don't hesitate to seek medical advice. Stay healthy, everyone, and as always, stay informed.